is Stephanie Spicer and I'm a Limey. I'm not a doctor and I'm also not an expert on this subject, so please be sure to do your own reading and get professional help. I've been learning about Lyme disease for years, but I've only just recently started trying to learn more about Babesia. I read a big old book this week, but it was written in 2006, so I hope that the things I tell you in this video are not outdated. But don't worry, I did check the internet too. In my previous video about co-infections, I shared how if you have Lyme disease, you should assume that you have other co-infections too. These are other diseases that often come along with Lyme because they're also carried by ticks, or just because they work really synergistically well with Lyme, as in the case of mold illness. I'm not going to make a video about every co-infection I mentioned or every one there is, but I did want to talk a little more in depth about Babesia. Babesia is the top Lyme co-infection, infecting as many as 66% of Lyme patients. It may also be far more common than we know, as cases often go unrecognized and unreported. In fact, it's thought to be the second most common blood parasite in all mammals. In areas without severe winters, it can wipe out large numbers of livestock. In cattle, it's known as Texas cattle fever or red water. It can also cause death in immunocompromised humans, such as those with HIV or those who've had their spleens removed. The European variety has more severe symptoms and is more deadly than the North American varieties, but Babesia is usually not fatal. Babesia is not a bacterium, like Borrelia burgdorferi, the microorganism that causes Lyme disease, is. Rather, it is a single-cell pyroplasm parasite that directly invades red blood cells. In this way, it's similar to malaria. This is how Babesia works. After entering the bloodstream via a tick bite, it immediately invades the red blood cells. Once inside, the organisms rapidly divide via asexual reproduction and fill the cell with organisms. Take a look at this picture showing the red blood cells of a highly infected person. Babesia causes large numbers of red blood cells to stick together, to use them as a food source and to gain protection against the immune system. This can cause the rupture of small blood vessels, which manifests as bruising or small red spots on the skin. It can also impede passage of the swollen red blood cells through the capillaries and cause blood clotting. As the infected red blood cells travel around the body via the bloodstream, Babesia can invade the endothelial cells that line the liver and the spleen. There they may form small cysts to protect themselves against medication and immune response. Once inside the liver and the spleen, the organisms can reproduce sexually, allowing for maximal genetic diversity. This cycle repeats every 4 months, releasing a flood of microbes into circulation and causing a renewal of symptoms. I know this sounds like a lot of bad news, but don't worry, the good news is coming. First though, let's take a look at some of the most common symptoms of Babesia. High fevers, headaches, depression, decreased appetite, jaundice, cough, vomiting, air hunger or shortness of breath, chills, sweats, anxiety or panic, enlarged liver, enlarged spleen, nausea, dark urine, sensitivity to light, muscle and joint aches, enlarged lymph nodes, bruising, chest wall pains, random stabbing pains, excess need of sleep, bloating like obesity, and profound psychiatric illness. Though there may be a lot of crossover between Lyme and Babesia symptoms, it's important to know that we're dealing with a very different animal here, which requires different treatment. It should also be noted that some Babesia patients experience no symptoms, and that Babesia can lie silent in the system for years. However, Babesia can impair your immune system's defenses, allowing Lyme to become more aggressive. It can also use chemical messaging to shift the immune system's attention off itself onto larger organisms such as worm parasites. I'm not going to discuss testing in this video because Babesia testing is plagued with all the ambiguities and unreliabilities that Lyme testing is. If you want an in-depth discussion about which tests should be used and why, please read the book. Short answer, IGeneX and National Diagnostic Labs offer useful tests, but it's a good idea to do more than one to confirm results. Suffice it to say, Babesia and all co-infections and mold illness and heavy metal toxicity should be considered if you have Lyme disease, especially if you do not respond to specific Lyme treatment or if it drags on or plateaus. Ticks can carry all kinds of different infections. Alright, now let's take a look at treatment. Because of Babesia's similarity to malaria, most treatments suggested for Babesia are based on malaria research. This should give us cause to hope, because new applications in malaria medicine have caused malaria deaths to drop drastically during the last 2 decades. According to Dr. James Schaller, you should expect nothing less than a complete cure for Babesia. However, you do need to be smart. The generally recommended treatments for Babesia are usually not strong or aggressive enough to eradicate the infection completely. If it's not eradicated, it can come back later. Since the lifespan of our red blood cells is 4 months, treatment should last at least 5 months. Generally, the longer you've been infected, the longer treatment will be required. It's recommended to take a break every 3 or 4 weeks to allow time for symptom recovery. It's also important not to let Lyme or other comorbidities get out of control while you treat. Medical protocols suggested by Babesia literate medical doctors such as Dr. James Schaller, Dr. Joseph Burrascano, and Dr. Richard Horowitz usually include 2 or more medications used simultaneously to work in tandem. These include Mepron or Primaquine, Zithromax, Artemisia annua, Malarone, Lariam, Heparin, Biaxin, Ketec, Flagyl, Bactrim, Tindamax, Planquenil, and Levaquin. Some use doxycycline too, because even though it's an antibiotic, it has been used with some success to treat malaria in India when other medications were not available. Newer possible drug applications include Alinea and ivermectin. New malaria medications are being developed all the time, and Babesia treatment rides on malaria research. I'm not going to go into questions of dosage, drug interactions, and side effects in this video. I would encourage you to read Dr. Schaller's in-depth discussions on these subjects. And of course, because these are prescription medications, you should and must work with a doctor. I would, however, like to take a minute to talk about one of them, Artemisia annua. Some common names for Artemisia annua include sweet wormwood, sweet annie, sweet sagewort, annual mugwort, and annual wormwood. Sweet annie grows wild in the American Midwest where I come from. You may have come across this ferny, dill-looking herb that has a surprising pleasant smell, something like very strong mint. Artemisia annua is not synonymous with other types of wormwoods. The specific chemical makeup of the plant is what makes it effective against Babesia, so we can't simply substitute other species of Artemisia and expect it to work. This herb and synthetic versions of it have been widely recommended and used to treat malaria, and its success is one of the reasons why malaria deaths have dropped so dramatically. This is how it works. Infected cells absorb Artemisia medications, and then the herb reacts with the iron there to create powerful sparks or free radicals, which kill the infected cell from the inside. It can easily cross the intestinal wall into the blood, and this ability does not change with repeated dosing. It can also cross the blood-brain barrier, but is considered quite safe. It seems to leave healthy cells alone and only attack those overloaded with iron, which Babesia hoards. However, remember that free radicals will be released into your system, so they will need to be cleaned up with the help of antioxidants. Detox is also important during treatment. As with drugs, it could be a good idea to use Artemisia in tandem with other solutions. Once again, I'll leave the details about dosing, interactions, and potential side effects to the actual doctors. Dr. Schaller actually wrote an entire book about this herb, but I haven't read it yet. There are other herbs that may also be useful for treating Babesia. A recent Johns Hopkins study investigated 46 different herbal remedies in vitro and found many effective against Babesia, including Cryptolepis, Japanese knotweed, Chinese skullcap, Alcornia, Adrographis, Bidens, cat's claw, neem, redroot, garlic, Sida acuta, noni, and clove. If you have anemia, you should work on building up your iron before starting treatment. You may want to supplement iron during treatment too, because even though doing so means that less pathogens will be killed, it will help protect your organs and your blood. In closing, Babesia is harder to treat than malaria, but there's a lot of hope for recovery.